Do you
Hey,
know?
Countdoors, we're live. We had no countdown this time. Cheeky. Please meet the amazing Mary Ellen Goldberg, who is live with us all the way from Florida. So thank you, Mary, for giving up your time. This is really, really cool. I'm in my camper van. People who follow Cam probably recognize it. Mary, as I say, is in a heat wave in Florida. But today we're going to be talking about recognizing pain, which is an absolute fundamental need that owners can understand how pain is presented so we can catch the disease early and we can have better options for our management, better success rate. Mary, please tell the viewers about yourself so everybody can fall in love with you.
Okay. First of all, we'll tell everybody the truth. I'm old. I've been a veterinary nurse. In the US, they call it a veterinary technician, but it is a veterinary nurse. I've been one since 1976. So that's when I got out of school. And so what is that, 48 years? Yes,
Wow.
47, 48 years. Anyway, I have gone from seeing pain that the animal, they didn't even recognize pain. When I went through school at the veterinary schools, I went through at the University of Pennsylvania.
Mhm.
And one of the big things that I did was I took a lot of rotations because I thought I wanted to work with horses, like all stupid young girls. No, people that are out there that ride and love their horses. That's fine, but everybody thinks they're
I
going to
wanted to
work.
be a horse vet, and look at me. I am far from a horse vet. But yes, we all fall in love with the idea of working with horses, don't we?
And I loved working with cows and sheep and goats and pigs. And so then you get out in the real world and you realize that this is hard work, physical work, And so you're not in a building that's climate controlled and you're outside and you have a ton of equipment to drag around with you. And so, very quickly I converted over to small animal medicine. But when I was in school, they didn't do pain at all. I can remember the equine surgeons having horses come in, orthopedic surgery,
Yeah.
and the main thing that was told, I don't want the animal moving around. I want them to stand still because they're going to ruin my work. Same thing for dogs and cats. And
Yeah.
we now know that analgesics are key to healing, to getting better, getting them up and moving faster. They improve more. So, that whole type of thing that I went along with is gone.
I
And
totally get it. Because when I was a student, I did a lot of work with pigs. And I look back to what we were doing in the farrowing shed, and I am horrified at what I just accepted. But I didn't know any better. And I think
well,
there is a lot of people that will put their hands up and go, yeah, didn't know any better at that point. We've made
and
huge progress.
I look at animals that I've worked with over the years. So we're talking about, 48 years, almost 50 years. And I look at animals that were absolutely suffering from pain. And what I used to think was, why are these animals so nasty?
Yeah.
Why do they want to bite? And it was like, well, all right, so here's my key one that now I just sink in my stomach and feel bad about. All these ear canal surgeries and ablations, that the ear infections that dogs had, not so many cats, but the dogs.
Yep.
I can remember these animals, and they were all aggressive, all wanted to eat your face, all, and basically what my job was restrain them. So
Oh,
it was brute force restraining them. And that's where I was good. I could hold them, hold their muzzle so the veterinarian could work on them, clean the ears. And when I think of the pain
I
these
know.
animals were in, and I say to
So does
my
that drive you? Is that a massive drive? Because I know for me, the reason I do this is because I feel like a bit like an ex-smoker, who's really vigilante about it now, because I've made mistakes. I haven't had the understanding that I have now, and I feel a little bit rotten inside, and I want other people to learn from my mistakes almost. So is that a driver for you as well?
Yes,
Yeah,
absolutely. And you know what? I think anybody that came through a period prior to what we do now would feel this way.
yeah,
Um,
totally.
because I can remember looking at some of these animals and saying, well, are they having pain? Well, no, animals don't have the same kind of pain that people do. And
Yes,
I,
that's learning. I can remember being at vet school and people told me you'll never see a fat cat. Cats never overeat. And I was like, okay, I'll run with that. But we have progressed so much in the last 30 to 40 years. And you have been quite a front runner in all of this. So because she'll never be honest at how wonderful this woman is. She's written countless books, written countless articles. If you are on any of the pain forums, Mary pops up all the time with articles, articles, articles. You're like, does she sleep? No, because she's always reading and disseminating information. She's fantastic. So what we've done is we've pinned her down because she's a very busy lady, and we have an agenda today that this amazing lady has made, and we're going to basically talk about pain recognition so that all of you guys can learn from what we've learned, and especially from what Mary's learned. But I'm just going to take a really cheeky advantage and put up a course that we have got available for free, because it's so important that everybody understands how pain is expressed. And this was written by the amazing Gemma Hodson, and she has basically allowed Cam to put it up in our education centre for people to access free of charge. So if you are interested to learn more about pain expression, then please head over and have a look at that course, because it is fantastic. Probably take you about an hour to 2 hours, and you can share it with your clients, with your dog owning friends, etc. So everybody starts singing from the same song sheet, which is great. Right, I'm going to put that away. And I'll put a link in the feed, so if people want to know where it's hidden, I will tell you. But let's crack on with your agenda, because
well,
you are
what
the
about
only.
what about
Mhm.
your book? Your
Oh,
book?
do you mind? Should we do the?
No, no, not at all. Everybody would love to see your book, and that can be for your clients, parents, and children sitting and reading about pain, and so the children can learn from a young age on, you
Yes.
know, and
Are
they
the graphics amazing? It's by a guy called Philip Nibbs, and he's done this for free. He gave up his time to illustrate the whole book. Having had an arthritic dog himself, he sees the importance of people really understanding more about this disease. And I don't know if anybody's recognized, but the key character just happens to be my beloved that I lost in 2018, which is Holly. So it's a kids book. It's I think it's £8.99. It's from the Cam shop, guys, and all proceeds go back to supporting Cam. And it's a brilliant way to educate the whole family about pain expression. Thanks, Mary. That's really kind of you to mention that. Now, being that you're the only guest ever to create an agenda, which I'm like, yes, she is on it. I think we should follow the amazing crib sheet that you wrote. So shall we start with about how we can assess pain in canine osteoarthritis. And we're going to look at it from a very behavioural aspect to start. So lead us on, Mary.
All right. So, a lot of the International Veterinary Academy for Pain Management, the gurus for pain, are looking at things, especially for osteoarthritis or looking at pain. When the animal comes in, they want to look at, are normal behaviors maintained? What normal behaviors does the dog, because that's what we're talking about, do?
Yeah.
Then there's going to be, what normal behaviors have been lost?
Yeah.
Classic example, the animal that's developing osteoarthritis, maybe they're not moving as much. Your video, when I lecture, your video that you produced of the man that walks and goes to the doctor and says nothing, I cry every time. I mean, I'm not talking about sobbing, but I tear up every time I watch it. People in the audience tear up. Everybody is just, because it is so powerful. And that was, I
We
got
will
that
put a
from,
link in the feed for anybody that hasn't seen it.
that
Yeah.
was from you, so it's very powerful. So loss of normal
But you know that's my
behaviors.
dog again, don't you?
Yes.
I
Oh
think I'm the
no,
most,
I didn't
the
know
most
that was
obsessed
Holly.
owner.
But
That's
I didn't know.
Holly. Yeah.
Oh my word, because people, when you watch this video at the very end of it, they use a man at the beginning, and the last shots are a dog leaving the veterinarian's office, and they have the dog replace the man. The dog cannot
Mm.
speak. And I was watching Holly. I didn't know it was Holly. The stride is much shorter than the stride of a normal moving dog. And I looked at how gingerly Holly was walking and taking steps, leaving that office door. And I thought, you can look at that dog and see that it is older, has back issues, joint
Yep.
issues, and isn't moving as well. So, see, I didn't know that was Holly. That's so people will
Yes.
enjoy seeing that. If they haven't seen it,
Yeah.
they will love it. So,
Lovely Lynn has put a link. It's definitely worth watching, guys. And it was written to really try and drop kick us into thinking a little bit more differently, because I think a lot of people accept a change in gait, a change in posture, a change in movement pattern as just part of aging. And I think we need to step away from that and actually go, before I go down that road, is there underlying pain? But the link is there, so please do watch it and please do share it. But let's go back to the behaviours. I
okay.
love the way that you've divided it into, are they maintaining normal behaviours? That's a good thing. Have they lost normal behaviours? That's a bad thing. Or have they developed new behaviours? Uh-oh, could that be a bad thing? And that 3 division is so good to be able to talk to your owners. And it's a bit like the CAM factor that we have, in that being able to talk to owners or being able to reason in your head is so important, because a lot of owners are very inhibited about going to their vet for fear that it's something about nothing. And I have that all the time, where owners come in and go, oh, I'm sure it's nothing. Oh, I really don't want to bother you. I'm sure I'm just seeing things. And what you've done is very simplified it of, are normal behaviours maintained? Have we lost normal behaviours? Do they not greet us at the door anymore? Do they not get on the sofa and join us? Do they not want to come and interact? Have they lost that little sparkle and the bond that you have? Or have they developed new behaviours, such as rubbing themselves on the sofa, like because they've got a sore spot? Or have they hesitate before they get into the car? Have they become a bit antisocial with other dogs or family members? That 3 division, fantastic. So simple but perfect.
When they eat, to think about, especially so for the cervical vertebra, the neck. Okay. So when they eat, is their dish so far down that it hurts their spine and neck to bend down?
Yeah.
Is this why they lay down to eat? Because it's actually better for them to stand for their digestion.
Yeah.
And when you see dogs that regurgitate, am I sounding or am
No,
I?
it's it's a helicopter's just got over. You know when you go, thanks, helicopter.
Anyway, that's one of the things that I think about with some of these, and they have them dishes that are, they almost look like they're on a pedestal, but the dishes, the water dish and the food bowl are raised so that the dog doesn't have to bend over as far.
Can
It's
I add to that? Can I add a few notes? So I ran a home service for quite a few years. So it meant that I got to be a real detective and watch a lot of what happens at homes. Raise the food bowls, guys, but make sure that your dog is still comfortable with the height. So some people get a bit overzealous and they might put it too high. Some people are a bit, they could be a little bit higher. But also the area around the food bowl, make sure it's got traction, make sure it's non-slip, because that's a posture that they're trying to maintain and have a pleasurable eating experience. So if they're a little bit scared that their feet might slip away because they're leaning forward and their weights come forward, if they're a bit scared, they're not going to have an enjoyable experience. So think about a matting around it as well.
another reason they may lay down is because in order to stand, it takes core strength.
Yeah.
What about the animal that has no core strength whatsoever? All they can do is lay down.
Yeah.
So, there are things that can occur. But I remember, or I learned, a veterinary pain short course that was given, I think it was in the early winter, um, for dogs. If the dog goes to the veterinarian, what are things that the veterinarian will probably look at?
Yeah.
The first is going to be the examination, so a
Yeah.
physical exam. They might also, for the osteoarthritic dog, want to look at physiologic, quote unquote, biomarkers. And people will say, well, Mary Ellen, that's great. What are they?
Yes.
What is a physiological biomarker? Things like synovial fluid, blood chemistries, urine, things like cytokines. These are specific blood tests, or interleukin 8. Those are physiologic biomarkers that can be indicative of osteoarthritis. So when you start to see a measurement that might go up, what if the animal is young? But it shouldn't be having one of these biomarkers be high. What does that mean? Could it possibly be early onset osteoarthritis? Something like that.
So with
So,
these biomarkers, just trying to think of what's pretty current in the UK sector. So I'm based in the UK. We definitely encourage people to get these biomarkers, and it might be more as a preparation for the plan. So making sure that the kidney, the liver, everything is in order, so that we can reference it when we repeat the test after maybe a few weeks or a few months being on a medication. I don't know of anybody that is doing cytokine and like interleukin tests, because I don't think they're freely available yet. And are they well validated yet?
They're starting to be validated. I'm trying to think. The paper that I looked at was a pilot study,
Oh, exciting.
but they're done in a research setting.
Yeah,
They're done all the time in humans,
yeah,
but not, regularly. For now, at veterinary universities in the United States, and I'm sure like at Glasgow or in London, that type of thing. I know they do those tests there, but the average GP probably would not. They would
no,
have to send to a specialist for that type of thing.
yeah.
However,
But can I just butt in, because I think it's amazing what you've said, because I remember chatting to a fantastic vet that I used to work with called Charlie Walker. If he's listening, he is the skin vet, and he's fantastic. And he did say to me one day, gosh, wouldn't it be lovely if in our lifetime we could do a blood test that could quantify pain? Wouldn't that be a progression? Because at the moment it's still very subjective. We still are working on, having an understanding and a knowledge base to be able to start picking up on these little signs that can tell you actually something's going on. Whereas a blood test, oh my God, wouldn't that help everybody out? But we're not there yet, guys. Watch this space.
and one of the things that will definitely, by the time, I don't know if you've talked to owners and your veterinarians about grimace scales. I
Yeah,
happen to love grimace scales because there's so many of them. By the time pain starts showing up in an animal, patient, human, whatever species you want to talk about, when you start seeing it in the face,
mm,
this is, you know, uh, it's very subtle to be able to recognize these signs
yeah.
that an animal may have in their face un, prior to getting it severe.
But
But
let's just qualify, that's still for acute, isn't it? We don't have a chronic pain grimace scale. Is it? Correct me if I'm wrong, because I really am not up to date in that. Do we have grimace scales for more of a chronic presentation, or are they more normally connected with acute?
do you know who has worked on this kind of thing? And it is acute. You can have acute on chronic
Yeah,
pain. So you have an arthritic animal that falls, they wrench a knee or,
yeah.
something, and they will have acute pain on chronic pain. The people that have done this are Dr. Paulo Stiegal and his wife, Beatrice Montoya, and she is still on the board at IVAPM. And they've done quite a bit. I could easily share, but it's cats.
Yes.
The animals that they work with are cats.
Have we got
And
it in dogs yet? We haven't got it in dogs yet, have
no,
we?
there is no grimace scale for dogs. And I spoke to, oh, I could send you her name. It's a woman in the UK, and she has compared dog um, facial action units with grimace scales. So,
Wow.
Mary Ellen, big deal. What's the difference? The difference is it's muscles in the face. Facial action units can show you expressions that
Wow.
the animal has. And she told me the reason a grimace scale has not been done for dogs is because there's so many breeds of dogs.
Yes.
They have not been able to get one together that everybody will agree on because
Do you know what? I
of,
think that's a really, really good point that you just make there. That the dog is a species that has so much morphological variation. They all look so different. You've got a Chihuahua to a Great Dane. And that isn't just to do with the grimace scale, that's to do with gait and posture. So, owners, don't feel bad if you think, oh my God, I just didn't know. Because there is so much breed variation, and it can be very easy to go, well, that's just how they've always walked, or that's how a little dog walks, or that's the posture I see in a little dog. So I think that's a really, really valid point to make. And any dog trainers or vet nurses, anybody listening, do remember that. Keep that in your back pocket. So if you have an owner that is upset that they have missed something, and they've come to you and you've said, actually, I think your dog's quite arthritic and they've been uncomfortable for a while, you can see them go white with absolute shock that they haven't acknowledged it. Have that in your back pocket to go, do you know what? Do not blame yourself, because there is so much breed variation out there. It's not surprising that you didn't see it, because you need that owner to be engaged. And if they start with guilt, that's going to really inhibit you getting a management plan in place. So just remember that little tip. Well done, Mary. I like that. I like it a lot.
Well, one of the other things that I look at is, over the years, as you say about the wide variety of breeds, I can remember, and many people that deal with these dogs will know what I'm talking about. In the US, a lot of hunting breeds, you could basically cut off their head, and they're as stoic stoic. They're just gonna stand there, and not complain. The Chihuahua, or let's go to the Pomeranian,
or what about the Italian Greyhounds?
Yes. And the miniature pincher, those little miniature pinchers, if you look at them cross-eyed, they're going to be yappy and they don't want you to touch their feet to do their nails. Now, is that they don't want you to touch their feet to do their nails because they've got pain in the feet? Or is it that they're just a nut
sensitive or in fear, isn't it?
Yes,
but I think
fear is huge.
Fear is huge, and I think we all have to remember that this is a very difficult area. And I love the way that we're dabbling around, but I'm going to bring us back into the consult room now, because we've talked about the veterinary examination, and we've talked about the physiological biomarkers, which are in their infancy. Let's take from the grimace and go into the other instruments that are readily available for us to use, because a lot of people don't know about this. If you've been listening to Cam for a while, you'll be like, oh, well, there they go again, objective monitoring. But it's really, really important, because it can really help with diagnosis, but it's also really important to make sure that the things that we choose to do are working. And I think there's a real belief in owners and many professionals that once I've started a treatment that should work, well, it will work. Well, it will work. Maybe it doesn't. Maybe we got the wrong diagnosis. Maybe we haven't given enough. Maybe we need an adjunct. So these clinical metrology instruments that Mary's going to talk about are great for beginning, middle, and end. And definitely getting owners to use them earlier is going to improve compliance long term. So we know that with quality of life assessment tools, if we can get people using them earlier, they're going to be easier to maintain, rather than introducing them late stage when everybody's emotional and doesn't really know what to do with them anymore. So tell us about these questionnaires, Mary.
Okay, so there are several. There are on the mark, or that have been developed. For owners, we're generally talking about activities of daily living. And that's what the assessment will be. If they get a form, it's generally going to ask them about, can your dog get up in the morning, walk around, go outside, come back in? It will be something. The classic one that's an objective measurement in research has always been the force plate.
Yeah.
And that's so the animal stands on it and you can see, oh, they're putting more weight on the right front or the left hind, which means if they're putting more weight on the left hind, are they switching weight off the right hind because it's hurting? So the force plate has been used for a long time, but now they're using something called an accelerometer. Dogs wear this on their collar, and it can tell you how fast they go. And, basically, it collects data of
Yeah.
everything that they're doing. And you download all that stuff to a spreadsheet and you've got it. And so that's been a big thing. But
Can
as
I just,
you
I can just butt in? And so this isn't a validated tool, but this is the sort of thing that we're talking about, guys. So accelerometers could hold the key for a lot of people. They could add so well to someone's treatment plan. Now, PitPat is a really affordable one. It's not a GPS tool, so it's not going to find your dog when it's lost in the woods, but it does have the ability to, monitor sleeping, play, exercise, which could be really useful to you. So I'm just when Mary started talking, I thought, oh, I've got to put this up so people can actually immediately go, oh, that's what they're about. They're not just there for fun. Yeah, they are interesting, but they can be really useful too. So I'll put that away. Please continue, Mary.
No, that is so. What I can talk about is, if there is something, they have developed in clinical terms what it's called multifactorial clinical measurement instruments. So these are things for the veterinarian and for, they might be more in two parts. One part that is given to the owner, the other part veterinarians and veterinary staff fill out and use. Now, I have links in my files, but what are some of these CMIs or these instruments? So Helsinki Chronic Pain Index, I think, is probably one that's been around the longest. And Jackie Reed developed it, didn't she? Jackie Reed
I thought that
and
was Anna. I thought Anna was the one working in Helsinki. I think Jackie Reed did the Glasgow modified and stuff. I might be
okay.
wrong.
No, I think you are correct about Jackie, but I'm trying to think who I got my Helsinki. I think
So
you have
Anna Heinrich Bjorkman, and I have
that.
said her surname really wrong, but I've listened to her lecture and I desperately want to get her on cam because she is inspiring.
Yes,
But yes, these
yes.
tools are paper-based tools and you guys can request them from your vets or you can download them, and we will put the links in so that you can go and have a look. Current feeling is you find the tool that resonates the most with you. So there are a number available, but you find the one that is you're comfortable with. Is that fair to say?
Absolutely. And I think what is important is you may have colleagues that say, because the next one I'm going to mention is the Chronic Brief Pain Index, and that was
Yeah.
developed by Dr. Dottie Brown, and she's at Elanco. And has she been on? She's wonderful, absolutely
No,
wonderful.
but if she listens to this, Daddy, please come on cam.
Well, Dr. Dottie, she's worked with this chronic pain. She developed it. I mean, it's been 10 years. And
Yeah.
so you may have one colleague that says, oh, I absolutely want to use the chronic brief pain or the canine brief pain index. Everything I've read says to use that, and I use it. Well, then we also, so here's my cheat sheet too. The
You've got a few, haven't you?
Cincinnati, the Cincinnati Orthopedic Disability Index. You've also got a health related quality of life index, which I love those quality of life indexes as the animal, as the dog starts to get older. I think it can have key behaviors key factors, key things to look at. Then one that was developed by Dr. John Innes in the UK
And don't
is
forget Ben Walton. He didn't do it on his own.
okay, is the Liverpool osteoarthritis index in dogs.
Yeah,
So the load, they have a load that's instructions for the owner how to fill it out. They
yeah,
give load instructions for the veterinarian or veterinary staff. So load has been a huge help
yeah,
to people. And then the newest one, I think, is the Canine osteoarthritis staging tool. And you can go on, I wrote it down, it's galliprantvet.com. And
yeah,
that will give you how you look at it, how you read it, what you use. Now, you can also type in the canine osteoarthritis staging tool, and it should take you
yeah.
right to web
But
pages for
I'm
this.
going to be really outrageous and turn this into a discussion of the strengths and the weaknesses. And then one of the weaknesses is people don't know about them. And that's a real big problem. We don't advertise their availability enough. And another weakness is people don't understand the value of them, so they don't take the time to fill them in. And that is both professional and owner led, that they just feel that it's pointless. It's effort for what? What does it achieve me? So we need to really counteract those two weaknesses, and they need to be both parties, both professional on one side of the table, owner on the other, go, let's use these because there's a lot of work gone into them and they can really, really support my management plan, but not very much. A lot of practices aren't using them. So guys, take home is, if you've gone, whoa, that'd be good to use. Where do I find these? Speak to your vet, or we will put a link, print it off, take it to your vets. You drive the use, and the vets will follow, because quite often we're burnt out. We've got so many clients coming in. We've got 8 people in a row every 10 to 15 minutes, and it might slip our mind, but go in and use them, okay?
And
So
if you're the owner and you can take in something like this, and I know of people that take their own, they buy a blood pressure cuff, they take their own blood pressure. So the next time they go to their physician, they've got 6 weeks worth of data to give
yeah,
okay, so this is my blood pressure for the past X number of weeks. Okay, so let's say you do one of these scales that you like, or these instruments, the metrology instruments that you like, that you take it into your vet and say, well, I've got this data that I've collected, and this is the activity that my dog has done for the past 4 to 6 weeks. Will this help you in any way in figuring out what's going on? Well, it's almost like, duh, it will help the
yeah, it
vet.
can definitely
It
help.
absolutely will help them in understanding what's going on, because they're sitting, reading, comparing, looking at what's happened, and it will help them to piece together a plan for what to use on their pet.
Yeah, yeah.
And
I think that's a perfect opportunity to just kind of step back a little bit in your crib sheet and talk about a few more of the behaviours, because we've talked about showing signs of diminished mobility, but just fire off some thoughts of things that people might overlook. Let's leave some real oh my god, because a lot of owners do struggle with picking up the signs of pain early. They do have a lack of confidence to flag it up. Throw me some changes that a lot of people wouldn't immediately connect with pain.
so you've got a dog that's maybe, quote unquote, middle aged, 7 or 8. and your dog used to go run with you, used to go to the beach and go for long walks with you. And now, your dog doesn't want to go as far and it's not as fast. And many people, and I'm not saying that it couldn't be, they'll attribute it to the dog just aging.
Yeah.
But is it really? Is it
Yeah.
just aging or is it pain in some way? So it's good to just be thinking about that in the back of your mind. What
Yeah.
about your dog that you've got a male dog and now your male dog goes over to the tree and it used to have its leg hiked way up and now it's a lot lower, or maybe it just goes out and squats like a female. It's not that
Mm.
old. What's the big deal? Well, is it
Yeah.
pain in the hips?
I'm gonna.
Is
Somebody's asked about younger dogs, so let's because I think that's worrying that we really overlook. Young dogs, older dogs are getting more attention. Like if you look at any of the drug companies' literature, if you look at any of the supplement companies' literature, they're very good at saying the dog that hesitates to do the stairs, the dog that struggles to get comfortable in bed, the dog that's slowing down. Young dogs are really not getting the attention that they need. And considering that osteoarthritis in dogs is secondary to developmental joint disease, which is present from a very early age, I think we need to talk a lot more about young dog potential clinical signs. And I'm going to kick it off with lazy. When I hear somebody say, yeah, my puppy, he's always been lazy, I sit there going, why would a puppy ever be lazy? Why would they be lazy? So if you have somebody saying, yeah, he's always been a couch potato, he's always been lazy, he never really wants to join in, that would be a little bit of a red flag to me. Can you add more? Think of other ones.
oh, if it, let's talk about some more breed confirmation. You know, let's say, well, oh, he was really active and now he's just not so much. And all right, but have you noticed that your dog is lame? Well, no, not really, but he's, you know, a year old. And so things can happen like epiphyseal
Yeah.
problems and things like that. Um,
I've got
also,
another one that's going to make people feel uncomfortable. It's another one
body,
that's going to, okay, training. Dogs that, when training, just seem to avoid the request. I don't really want to sit. Oh, no, I really don't want to come back. No, I don't really want to do that activity. And people are like, oh, they're adolescent and being difficult. Oh, you're going to have a firmer hand. Oh, you need to take this seriously. If they don't listen to you now, what happens if that dog's going, I don't want to do that activity because it's actually quite sore? So I think any dog that really is struggling with training, I think that's a bit of a red flag too, isn't it?
especially a young dog,
Yeah.
you know, um, in physical rehabilitation, there's a term called sit pretty. So
Mm.
what it is the dog sits square. It doesn't slouch one hip to the side. Many dogs do that. They've done it since they've been young. Is it pain that's causing them to do that
Mm.
instead of sitting squarely? If it's always done it, how do you know? You
Yeah.
just you just don't know.
Well, you can
So
know in that you can get a physio or a veterinarian to look at your dog. So if you've got a dog that, as you say, slouch sits, because Luna does it every now and then. Oh my God, do I check her hips on a regular basis? Oh yes, I am paranoid. So when she slouch sits, I'm like, oh, what is it? Is it something? And then I put her hip through a full range of joint motion. I abduct it. I'm having a feel. I'm feeling muscle mass. I'm thinking, Is there any other clues that could indicate that this is actually something more significant? So you can't have anything on its own. That's something I think people really need to be aware of. It's a bit like reading an X-ray. You're always going to find something on an X-ray, but is the clinical sign matching the picture? What we have to do is go, the behavior change, the posture change, the physical change needs to be backed up by an assessment. And this is where we need to get the confidence back in that veterinary client patient relationship, the VCPR, which is here in the UK sometimes struggling. I don't know what you have over in the US, but there's definitely a rise in people feeling a bit despondent with vet care. They're feeling a little bit hesitant about engaging with it, and that could be having quite a negative impact on the animals that we both love. Do you have the same happening in the US?
Yes, absolutely. And I think the pandemic has escalated that type of thing.
Yeah.
Because in the United States, and it couldn't be helped. In the United States, the veterinary personnel would come out to the car, get the animal, get the dog, take it into the clinic. So now, as the owner, you have a blank screen because you don't see what they're doing. You don't know what, and all you can do is say, well, this is what I think is wrong. Or, hi, this is Trixie. She's coming in for her vaccinations and her yearly checkup. Well, have you noticed anything unusual about her? No, not really. And the client talk has been cut short because of,
definitely,
I'm taking my dog, or they're taking my dog inside. I don't see what's happening. There's no interaction really. And then the veterinary nurse or assistant or somebody brings that, hi, all vaccinations done, everything's good. And it's, that's it.
Yeah.
So,
We have got things changing here. So Boris, good old Boris, has said as of July the 19th, lots and lots of things are going to be opened up, which is amazing. So hopefully we can recharge the batteries of the vet client patient relationship, because it is so important that we rebuild this bond. And if you're an owner that is thinking, oh, I wish I had a better relationship with my vet, drive it. Drive the relationship by speaking to them. Speak to reception, speak to the practice manager, find somebody in your practice that is interested in chronic pain. Stay with them. A mistake that a lot of clients make is when they phone up to book an appointment, they say, I'd like an appointment on Thursday. So the receptionist will only but give you the vet that's on Thursday. If you phone up and say, hey, I'd like to see Neil, and then they'll say, well, he works Tuesdays and Wednesdays. Okay, I'll go in on Wednesday. So that very, very, very simple thing of not asking for the day, but asking for the vet will mean that you'll start to get consistency, because it is possible, guys. It is possible. Okay, so do not forget. I'm going to throw another Grim Reaper young dog behavior that people would go, oh my God, I've seen loads of those. The appeasement behavior. When the dog is over affectionate, they're all over you, they're a bit needy, they're a bit anxious, they're so willing to please, and they just uncontrollable affection. And you just sit there going, wait a minute, what's going on here? Why is your brain wired so much to be, oh, I love you, everything, anything, I'll do anything. That, I've seen that a few times, and I think a lot of people would not put appeasement with pain. It just doesn't connect. But I think it's just any kind of like extreme behavior that's persistent needs checking out.
And for the dog, they don't know what to do. It's just like your video, they're silent. They can't say,
Disappear. Where have you gone? Come back.
I'm here.
On. We're back. We're back. It's okay. What happened there? We had a glitch. Yeah, so carry on. The dog in the video.
the dog in the video um, can't say anything. Well, what if you have a young dog that they can't say anything? So this is an older dog. It's not a calm dog because it's old. Let's say it's a hyper dog. Are dogs always hyper because of breed, or are they hyper because of something else? It's something to think about,
It
and look
really
at
is.
and try to assess. So,
Yeah.
I think, you know, also some of the things that we look at, and this was a big one, it wouldn't be, can you all remember the animals that would have lick granulomas? Always
Yes.
licking a particular spot.
Yeah.
These can be young animals or old animals, but they're continually licking somewhere. Are they doing that because they just are nuts? I can remember we used to have this stuff called bitter apple. It never worked.
Yes.
It was the
No.
nastiest taste because I used to taste all this stuff. It was the nastiest tasting stuff. It never worked. And that was given to owners all the time. Well,
Yeah.
now what have we learned? We've learned that this continuous licking, continuous gnawing, continuous chewing of a particular area, what if it's some kind of nerve pain?
Mm.
And something that has helped with granulomas is the the laser therapy,
Mm-hmm.
photobiomodulation. That has helped tremendously, but
Mm-hmm.
that also helps with pain.
Mm.
So, think about your dog or cat if they're over grooming, over licking themselves. And one of the things that, and I lecture about it, what about these obese animals?
Mm-hmm.
Osteoarthritis comes on these animals, and inflammation is a huge component of pain. And all that adipose tissue, the brown adipose tissue, whether it's the gut or wherever it is, that's causing inflammation. And
Mm-hmm.
that inflammation equals pain. And so the obese animal, you know, when I talk about it and lecture about it, I tell people, so you have the dog that is big and fat, and they've been that way since they've been young. Oh, my dog just loves to eat. Can't do anything about it. So the dog that is obese, in clinical studies and research studies, I've seen it done from rats all the way up to people. But when studies have been done on dogs, the dog that is obese dies 2.5 years sooner
Yeah.
than the dog that is not obese. So
But
those thinner dogs, they live
they
longer.
live longer. But we've got a big, big problem, and I witnessed it today because I'm down in Cornwall, so I'm in Gwithian, and I've been walking around, and you can't help but look at the dog population around you. This is a really big dog walkie zone, and I would say easily 3/4 of the dogs that I saw today just walking were overweight. And because it's so normal now, people don't even see it. They don't see it. And I'm trying to be kind, I think. No, I know I am trying to be kind. If you don't see it as a problem, how can you manage it? And we've gone from a society that visualizes dogs with a waistline and going, oh, that's lovely, it's got a waistline. We now, the log dog is almost socially acceptable, and people don't see it as a problem. And I think we really need to step away from that.
Well, think of, let's go back 100 years. It's not that far. Let's go back 100 years to German
It's not that far.
shepherds. Well, to German shepherds.
Yeah,
Look at the conformation that German shepherds used to have and look at what they have now
yeah.
for for conformation standards. It is it has gotten to where you know, we're breeding dogs for their looks, not for health or things like that. And
Which I think brings you on to a brilliant point. Somebody said this earlier, and I wanted to bring it up. Where is it? This. This is a really, really valid point. Acceptance of breed deformities. That when a deformity turns up in a crossbreed, people don't understand it may be more of a problem. Yeah. Now, this is a really brilliant, Lynn. You've been saying some fantastic stuff tonight. We see this. We see this all the time. We see this with Queen Anne legs. We see this with long backs. We see this with lots and lots of breed morphology that we think, oh, well, they're getting on with life. It can't be a problem. And
well,
what we do know is dogs are amazing at coping. So when you start seeing a physical appearance that you go, that ain't quite right, I'm just going to check it. It's definitely going to be a problem, guys. That's what you've got to not be scared of. You have to open your brain and go, I just want to check that this isn't got an underlying issue. And you can do that very simply. So say you've got a dog that's got Queen Anne legs, you know, when they're like this. I can't do it. Hello. You know, when their wrists are facing outwards, their elbows are facing outwards, they're all a bit contorted. You can actually just put the joints through a range of motion and go, is this comfortable? Is this comfortable? Have we got any muscle soreness? And it isn't definitely going to be a problem, but it's really worth catching it early if it is. Do you agree?
absolutely. Absolutely. It is. And
Yeah,
so, it is, it's other things that, you mentioned. Uh, what about the activity that they do? I've seen this more in horses, especially when you're riding them. But what about the animal that can go in one direction, like go to the right, but they can't go to the left?
yeah,
See, that's why in riding they want you to work a horse to the right and the left for all the type of exercises that you put them through, because is the reason that the animal, especially, and you can use this for dogs too, is the
yeah,
reason why it won't turn to the left the way it
yeah,
will to the right, is it because of pain?
yeah,
So
definitely.
animals that, or dogs that are being shown in obedience. Oh, my dog works great to the right, doesn't want to go to the left, or goes to the left, doesn't want to go to the right.
Yeah,
Is that something, maybe something to be checked out
yeah.
and
I think,
looked at as a puppy? Well, the
yeah,
puppy doesn't want to
I'd
go
sorry to,
one.
sorry to butt in, but I can remember at the beginning when I started getting obsessed about chronic pain, and I felt overwhelmed with what I was reading and learning. I suddenly realized nearly every animal I saw could be in pain, could. And you're like, behavior change, posture change, physical change. Oh my God, I'm never going to be able to do a vaccine without diagnosing pain. I'm never going to be able to do just a neutering and not say, well, there's pain, because how do you work out whether that change is significant? That's where the owner vet or owner physio relationship's really good, because you go, could it be pain? Now let's assess. Let's have a really good review. And that might be a clinical exam, soft tissue exam, orthopedic exam, all brought together by a professional to either put your mind at rest that it's not, or to say, yes, well done, you caught it early. It's not your, it's the helicopter. He's come back. So sorry.
And and the point of starting this, I mean, when I talk to people about pain, I say the first
Oops, sorry.
pain That's okay. The first pain exam should be done when that puppy comes in at
Mm.
6 or 8 weeks old. And every time that animal is seen, that dog is seen, there needs to be a pain score done. Oh,
Yeah.
this puppy came in, it's fine, it doesn't seem it's in pain. And people say, well, so what? Why do I want to have a pain score done? It's always zero. It's been zero since the puppy was 6 or 8 weeks old. Well, okay, so it has been zero since 6 or 8 weeks. At a year and a half, the dog comes in and it's dead lame.
Mm.
Why? Why is
Mm.
it lame? What has happened to the leg? Is it something that the animal injured itself while it was outside running around in the backyard?
Mm.
Or is it something developmental?
I
See,
definitely, that's
so, so the trend that it sets, trends are hugely important. And that's why
hugely.
I say, you know, every time that the pet gets taken to the vet, I want a pain scale in there. The pain is the fourth vital sign.
Yeah.
So temperature, pulse, respiration, pain. The
Yeah.
fifth vital sign is nutrition.
Yeah.
So, these are things that have been looked at over the years, and it's very helpful to have them and to
I agree.
assess all
And you've just given
five.
me an amazing idea, which I kept thinking about. We, for a long time, have wanted to write a course for owners going to puppy groups. So, like with computers, you can get a plugin to make your website work a little bit more. We want to create a plugin that people that do puppy training, puppy socialization and development, they can offer their owners when they're receptive and listening. At some point, your dog is going to have pain. It's pretty unlikely that your dog is ever going to get away with a whole lifespan with no pain. And I want you to be able to pick it up early. So please read this. And we have got an amazing handout coming up soon because Laura's just popped up. Laura is amazing. And she's written a beautiful handout that's going to be available for people that do puppy classes. But also, remember this, guys, this is now available. You can use this in your puppy groups, in your socialization, in your development and training. You can flag people to go here and say, I want you to do this as part of your development, so that if you get any concerns, we catch them early. So that's just button in there. There you go. It's not only for older dogs, it's for young dogs too. I've just looked at the time, Mary, and we've been going for an hour. And I know that people start to go, where's gin o'clock? Where's wine o'clock? We're here in the UK. I would like us to do quick fire 10 top tips. I'll do 10, you do 9. I'll do 8, you do 7. Okay. And they've got to be short, sharp tips from the heart, Mary, from the
Oh,
heart.
I should have remembered this from the last time.
Don't worry, you're going to be fine. So I'm going to start with number 10. And number 10 for me is catch it early. And if that means that you go to your vet and you flag up things that you're a little bit like, oh, is it a worry? Is it not a worry? I don't know if it's a worry. Is it not a worry? Say it. Just say it. Just say it. And if they say that's nothing to worry about, whew, but don't sit on things. Catch it early. Number 9.
Okay, so number 9 would be, that as your dog starts to go from puppyhood to adulthood, that there may be things that occur that change. So the changes that occur, is it something that could possibly be normal, or even as a an adult young dog? Is it slowing down because of pain, or is it just an adult now, so it's not as hyperactive as a puppy?
Yeah, it's a
You know,
question. Yeah, love
so,
it.
something to be thinking about.
Number 8 for me, and people don't like this one, balls, frisbees, sticks, stones, whatever it is. We always have owners go, oh, but he loves it. He loves it. I can't take that away. I just want you to stop and think. because we know from the physical aspect, stopping, starting, braking, twisting, turning, impact forces. Unhappy joints don't like that. Unhappy soft tissue don't like that. You can modify that behavior. They can still carry the ball. They can still find the stick. They can still hunt down the frisbee. But those things that you love doing with your dog, think about adjusting them. Number 7.
Number 7, I think of as nutrition. Do My dog begs all day long. I can't get it to stop eating. You know, you don't know what it's like living with this animal that just sits and begs all day. Well, guess what? Yes, I do, because my cat begs all day and I just tell him to shut up and go away. Now, people are going to say, well, that woman, she ought to be turned into the SPCA. But I mean, seriously, I do. I just go, shut up, quit complaining. It's not dinner time. You have to wait. If it's not always that when you give them food, they're going to love you more,
Yeah.
because in the long run, are they going to love you more, or are
Or they
you
can get fat.
killing them with kindness because they're going to die sooner?
Yeah,
And so
that's a good
that's
one. Number 6 for me is an extension of that, is interactive feeding toys. I just can't wait until there's studies, and you can keep an eye out for me, Mary. I want to see studies that show that this repetitive, calming, interactive feeding techniques can have an impact on pain perception. I know it's possible. It makes sense. We know what happens with the neurochemicals. We see what happens with them. Bring in interactive feeding, so licky mats, snuffle mats, all of those sort of things into your pain management plan. Number 5.
okay. And I will add to yours, those things are used for physical rehabilitation in ways to get your dog to take its mind off pain. And this is an adjunct to, oh, the animal is interacting with the puzzle and doing this. And it may be a little painful, but you know what? It's doing more than it did. So I like that one a great deal about the puzzles. Okay.
Yes,
Um, so I'm on 5.
you're on
Is
5.
my I'm on 5. Well, is my dog uh protecting a specific area? Is it what's termed guarding a specific area? I go to touch it on a specific place and it turns from me and gives me the other side.
Gives
Is
you the
there a,
eye.
is there a reason for that?
Yeah,
Is it hurting? Is there
yeah,
something like that? So I think that you put fear, guarding behavior, all of that kind of stuff can go together too.
I like that one. Okay, number 4 for me, and I've said this a number of times, there tends to be a reactive component in us. Instead of us being proactive, we tend to react. We do things when the horse has already bolted, so we shut that stable door too late. A key one would be using these mobility harnesses. And I think people are a little bit in fear of what they demonstrate to themselves and to the public of, my dog's wearing a rear end support harness. It means because he's really struggling. I don't want to see this. I don't want to accept he is. Use them earlier, guys. You would not give a mobility device like a Zimmer frame or a walking frame to someone that can no longer walk. That seems daft. You bring those tools in when that person still has the capability to protect it, preserve it, prolong it. Don't be scared of using mobility supports. Bring them in earlier.
So, yes,
Number 3.
number 3. In the same token, I would like to suggest keep an eye on urinating and defecating habits. A lot of times, so I can remember as a child, I grew up with Scotties. So when you talked about the dog that doesn't want to learn or do anything, I think anything that has terrier as its middle name equals stubborn. Now, and that's because in obedience class, my Scotty went up against collies and poodles and Shelties and German Shepherd, all the dogs that learn things really fast. And it took 1,000 trials for my Scotty to do it. And it wasn't because he was in pain, it was just because he was, oh, for crying out loud, he was a terrier, you know. I mean, and so, but anyway, so what about, and what I was getting ready to say was, so when I would let my dog out to to go to the bathroom, I opened the back door and he ran out in the backyard. I never watched anything. Well, sometimes it's helpful to watch what they do when you
Yeah.
let them out. Are they urinating, defecating normally? Are they running around crying? I'll tell you, I knew a dog that, so years ago, so here's from experience, years ago, um, when a dog had a broken pelvis, they didn't repair it. It was the animal has
Mm.
cage rest. Now, can I tell you, an animal can heal. Now, the bones might be all messed up in how they heal, but I knew a particular dog. It was a little mixed breed dog. It had been hit by a car, had a broken pelvis. Back in the 70s, they didn't repair those. The dog had cage rest. And from then on, when the dog went out and went to have a bowel movement, it screamed
Mm.
bloody murder.
Mm.
And I mean, to the point where the owners were embarrassed to take the dog out to go to the bathroom because they were
Mm.
going, oh my God, it's just screaming. Nobody picked up on the fact this was painful. There
Yeah.
was some kind of bone that had healed and it was just painful. And so
No.
that's the kind of thing that, you know, watch the pet.
Watch the
Is
pet.
is it
I like that. And I'm going to add to that. And this is totally from my opinion. Okay. So this is just my opinion and what I've learnt with my own dog experience with Holly and Luna. So Holly, even at the end, when she was pretty broken, if she smelt a fox, if she saw something, even with her buckling back legs, she would try and run after it. She had some naughty little idiosyncrasies that stayed till the end. But when she did do that, she hurt herself. So if she went and tried to chase after a fox and she got the welly on, the back legs would be going everywhere. She'd probably fall a little bit and she made herself worse. Now I'm in the same position with Luna. She started a bad habit that I have got to nip in the bud because it could be a problem later. We find them funny at the beginning when they're young, but if you jump ahead and get your crystal ball out, you can see it's going to be an issue later. So Luna has now started, when it's dark, she pegs it out the back door, across the thresholds, flies down the patio steps, bolts it round the garden like a lunatic. And I'm already thinking to myself, I've got to nip this in the bud because when she's older and things are broken, that neurochemical change that happens when she sees something that triggers that behavior, that will override pain. That will always override pain.
oh,
And I know that I've got to nip it in the bud because I don't want to be the owner that when she's got arthritis in her back and her knees and her hocks, because she will get it, 80% of dogs over the age of 8, I don't want to be the person that goes, oh God, there she's bolted down the garden again and she's going to be laying for 3 days. So it's just a silly thing. I've never said that one before, but I'm glad
but
you
it's
triggered that
true.
thought in me.
It's very,
Number
very
one, number one for you. Come on, Biggie, take home.
for OA, for osteoarthritis
Yes,
in
the
dogs
biggest tip.
is learn to go look up and learn to some of these mobility scales,
Mm.
um, um, uh, quality of life instruments. Look at them, read them. Think about your pet, whether it's 1 year old or whether it's 15. Look at those things and learn to keep records to show your veterinarian so that when you go in, um, you don't sound like some crazy owner that has come in. Oh my God, well, I don't know what's wrong. What's happened? You might very well be able to track things. And I think that's hugely important to be able to show the veterinarian when you're talking about pain.
Yeah.
So, this
What we'll
is,
do is we'll put some links like we do normally so people can have easy access to what we've been talking about. Because I think you're right. For a vet, when someone comes in and says he's not right, you're like, okay, where do I start? It's quite daunting to have small room, very little time, lots of pressure, and no clues to what the problem is. So going in with more information is certainly going to put you on a good footing to get the value out of that consultation. Now, I'm just looking
and
at the time, Mary. We've been going for 1 hour and 17 minutes. I'm watching people beginning to fade away because they've gone off to get red wine and gin and tonic, which I totally understand. I want to say a massive thank you to you giving your time. This lady really, really is a legend, and we are so, so lucky to have her. There was, I'm just going to remember because somebody wrote right at the top, I think it's Michelle who's just said thank you. Somebody asked about CBD, or I mustn't forget that. Yeah, Michelle. Sorry,
oh,
Michelle. Totally didn't ignore you, just slipped my mind. We're in
I,
different categories here. The US and the UK sit differently on CBD oil, don't we?
yes, we do. And, in the United States, so here we are, it's legislated by each state. So, you know, there are people that they will tell you they swear. But and you've had Steven Stahl on your program before. The
Yeah,
the
he's
um
coming back again, end of the year.
the CBD King. And have you had Liz Houston? They've co-authored or co-edited a whole book about CBD and veterinary medicine. Oh
Oh,
yes.
cool. I'm going to get hold of that.
And
Stephen, if you're watching this, send me a copy.
and Jamie Gaynor, have you had Dr. Jamie on?
No, but I would like the contacts.
Hugely knowledgeable. So there are four editors that I could put you in touch with and send you a copy of the book. And, it would be wonderful because people can start this is something that it's not a prescription drug. You can, at least in the US, you can buy it over the counter for
Mm.
your dog or cat. It's in everything now, but as Stephen has taught me, there are brands that have better therapeutics, better reputation than, you're so that you're not just wasting your money. And
Yeah, yeah, yeah.
but yes, I
I think
think,
it's really exciting. Just so that people know where we stand in the UK, it is considered a medicine by the Veterinary Medicines Directorate, which means that it should be prescribed by your veterinarian. And because there are no licensed products for animals, we're stuck. We're completely stuck. So we want to prescribe it if we feel it's suitable, but there isn't anything that we can prescribe. But
uh,
it's readily available on eBay, Amazon. But the problem is it's not regulated. So we don't know what's in those products. So Michelle, it's not that we're saying no. the problem we have is we still don't have products over here that we are allowed to prescribe for you. We have to use them at the end of the prescribing cascade, so we have to try everything else first. And we also still have a lot to learn about it, in that we know that there is a potential for drug interactions, but we don't know what they are, you know. So we have to just work as a team. Please talk to your vet about it. Really do talk to your vet about it.
And if they say, I think it's an excellent idea, so Ellevet, ELLE dash VET, I'm fairly positive. So you can go on their website. It is in the United States. I think you can just send away for it and they would
Yeah,
ship it
we
to
can't.
the UK.
Yeah, we can't do that. No, because it
Oh,
has to be
okay.
via your vet. It has to be, if you want to go down the legal route, so it has to be a discussion with your veterinarian. And just doing a flag in case anybody from the VMD is listening, we do not endorse people going online and buying it. Okay,
Okay.
we
So,
really don't. Yeah.
so in the US, that's the only way they get it
Yeah.
because the veterinarian will not stock it since it's all state regulated. They don't have it in their practice.
Yeah.
So when the veterinarian says, you know, I've been looking into this and I think it's a good idea, they'll tell you a website to go to get it
Yeah.
because they don't have it at their practice
Yeah.
since it could be considered illegal for them to have it at their
And I think
practice.
it's so hard for the public to understand when it's so readily available. And I hope that Cam is doing a good deed and trying to get the greater understanding out there. It's not that we say no, and it's not that we say yes. We just say that there's a murky water going on. What we would say is that any animal that is considered in pain, you use a product that has the most evidence, because at the end of the day, you want your best mate to be out of pain as quickly as possible. And our current strategies of non-steroidals have way more evidence than the CBD does yet. So if you're sitting there going hemp oil or non-steroidal, I know my dog's in pain, I would suggest non-steroidal, chat with your vet and see if hemp oil can be added. But yes, there's still a lot of work to be done. On that note, I hope that's helpful, Michelle. It's lovely to meet you. I think you're quite new here, so hi. Please join Holly's Army, because that will really help you out as well. Good. I'm glad it's helped her so much. That's good, Michelle. Thanks, Mary. I'm going to say goodbye because we want you back and I don't want to burn you out and you not come back. So we've got to preserve you. We've got to look after you. And we will see you guys next week. Thursday. We've got a live on Thursday. So please come and join us then. And thank you very much. And you're lovely. You're just wonderful. Until then, guys, take care.
Everybody take care.